We're going to dive into birth control today. Hi, I'm Dr. Bala, and I work with women who have period pain, PMS, and heavy bleeding, but don't want to be on birth control, and I've been working with them for the past 6 years, and we're going to dive into birth control today. I know it's a controversial topic, but let's dive into some of those controversies and what you actually need to know about birth control. The first misconception that is a really big one is that birth control is regulating your hormones. And the reason that everyone thinks this is the case is because when you go to your doctor for any kind of period issues, any kind of hormonal concerns, what do they tell you? They tell you to take birth control because it's going to regulate those hormones. It's going to fix the symptoms that you're dealing with around your periods. And this is a really, really big misconception that I want to make sure people understand. So of course we have a population of confused women taking birth control for their hormones because this is what their doctors are telling them. But here's what is actually happening when you're on the pill. When you are on oral contraceptives or birth control pills, you are taking a steady dose of estradiol and progestins, not to be confused with progesterone that your body makes naturally. And when you have this steady dose of hormones, what happens is we are shutting down your HPO axis. And this axis is what is giving your brain and your ovaries the feedback to ovulate. Here is what is happening in a healthy cycle. You have a rise of estrogen, and that feedback triggers the release of an egg. And then your corpus luteum is secreting progesterone if no fertilization happened, and then you shed that lining and you start all over again. This is what a natural cycle looks like. So if you are someone who deals with heavy bleeding, PMS, mood swings, endometriosis, really bad cramping, really bad migraines, your estrogen levels may be too high in that follicular phase, and you might be building up a very thick endometrial lining. Or it might be that progesterone levels are too low in the luteal phase, and there's not enough to oppose that estrogen. Birth control comes in, and it's going to shut down that whole process. So guess what? Now you don't have that hormonal cascade that was happening throughout your natural cycle anymore. And so when you don't have that natural cascade of hormones happening and that natural cycle going on anymore, your symptoms that were associated with that up and down of those hormones are not happening. So you're taking the exact same amount of estradiol and progestin every single day. And when you stop taking it, you get a withdrawal bleed. If you never stop taking those pills, you'd never get a bleed. And if you took the placebo pills every 50 days or every 50 weeks, that's how often you'd get a bleed. If you took it every 5 days, you'd get a bleed every 5 days. If you took it every however many days, right? So that is how the bleed that you are getting when you're on birth control is working. It is not because of the feedback mechanism going between your brain and your ovaries to signal to your body, hey, we need to shed the lining. It is just that withdrawal bleed from the removal of the constant steady stream of estradiol and progestins. That's why your symptoms of breast tenderness, of period pain, of PMDD, of bleeding through your clothes, clotting, all go away when you're on the pill because you're shutting down that hormonal cascade. So of course, the symptoms that you experienced along with those periods and those hormones shifting have stopped. So if you're just stopping the entire process, are you actually regulating it, or are you just covering up the symptoms? It's like breaking your arm and then taking pain medications. Are the pain meds fixing anything? Not really. But does the pain go away? Yes, it does. So does that mean we're healed? No. So having period symptoms, just like pain when you hurt yourself, is our body's way of telling us that something is off. Something needs attention. So if we're not going to listen when our body is talking to us, it's going to start yelling. And that's when we have those symptoms of really bad pain, really bad headaches, really bad migraines. We're bleeding through our clothes. We can't go out anywhere. We can't do anything. We have to live our life around our periods because now our body is yelling at us, hey, something is wrong. Do something about it. So if you're struggling with PMS, if you're struggling with PMDD, if you have heavy bleeding, if you are stuck in your house because you're afraid to go out, you have to cancel work, you have to cancel your meetings, you're in bed from pain, we need to look at what is going on in your body. How is your nervous system doing? How is your stress level? What are you doing to manage those stress levels? How do you sleep? Do you fall asleep easily? Do you stay asleep through the night? Are you feeling good when you wake up? Do you have energy all day? Do you have energy in the morning? Are you dragging yourself? All of these are going to translate over into really bad PMS symptoms, really bad mood swings, really bad irritability. So if your nervous system is a mess, we got to start there. So what's going on with your blood sugar? Do you feel hunger all the time? Or do you feel like you're craving so many things in your luteal phase? You're always looking for some ice cream and pizza and carbs. Do you feel insatiably hungry? What's going on with your insulin levels? How are you getting enough fiber? Are you getting enough protein? Are you moving enough to regulate that blood sugar? All of those are going to translate into different types of PMS symptoms as well. Do you struggle with a lot of bloating and a lot of weight gain? Do you struggle with a lot of acne? What is going on with your liver metabolism? How is your gut excretion of your hormones? There's so many factors that we need to consider as to why you are having the symptoms that you're having. All of these things matter for your periods, for your hormones, for your overall health. And all of these things are neglected by so many of us. And then we have these horrible period symptoms and we have debilitating periods and we wait until it is so unbearable that we are desperate for birth control. And I do want to be clear, if you want to be on birth control, that is totally your choice. And that is the beauty of being able to have the choice of being able to be on birth control. But I want you to understand that birth control is not regulating your hormones. It is covering up the symptoms. It is stopping your natural cycle and your natural period from happening. And if that is what you want, that is what you're looking for, that is your choice. And I really want to make that clear because I don't want you to think that I am telling you that you can't be on birth control, that you have to fix your hormonal issues in a certain way. That is not the case at all. I just need you to know what your body is asking, what the symptoms that you're dealing with are telling you about your body. And if you know that and you're aware and you are choosing to be on birth control because you just want some symptom management, that is totally okay. That is your choice. But a lot of us are getting told that birth control is our only option. There aren't other things that we can do to manage these symptoms. And that is who I'm talking to. I'm here to tell you that there is so much that we can do. You don't have to have birth control be your only option if that is not what you're looking for. If you like this video, you're probably going to like this one too. So go check it out here.